Okay, so as you can see, this is going to be interview preparation for medicine and dentistry, mainly MMI style, though by learning MMI style, it's traditional as well. And for those who don't know what MMI is, MMI stands for multiple mini interviews. My name's Ibrahim Ali. I'm a fourth year dental student at Manchester, and my partner Tom has a BSc, so he's done bioscience, and he's currently a second year medical student in Exeter. Has he joined us? Tom, can you hear? No?
Mm,
Oh, I can hear you, but you can't hear us. Right, so yeah, carrying on. Prasan, could you go to the next slide, please? Prasan? There, cheers. So yeah, so general tips, and before I get onto this, I want to talk about my personal hardest interview moment. So when I was applying to Manchester, I think back in 3 years ago, they had a traditional panel, and they were playing bad cop. So there's something called good cop, bad cop. You may know what it means. It just means that one interviewer plays very nicely and friendly, and the other interviewer is quite strict and quite difficult. Um, so this guy, he goes through my personal statement and he's like, "Oh, okay, very interesting. You've done this, this, and this." And I go, "Yeah, yeah, I've done this." And then the other interviewer goes, "Okay, and I'm like, well, that's it, really. I've just said what I said on the personal statement. Like, I don't know what else to explain." And he was very, very like brutally harsh. He wasn't smiling. Very, very like it's like when you know when somebody doesn't want to be talking to you. It was like that moment, that feeling, and that was an awful feeling. So beware that some interviewers actually are instructed to be like not as nice as they could be. Like they're very, very like difficult people. So that's just one thing to be aware of. And some other general tips, especially for Zoom. Um, we were going to share this. Tom was actually dressed up, if you saw briefly, in a shirt and tie, and I am in a currently a what's it a next jumper. So what is more appropriate is to wear a shirt and tie. You want to make sure you're still looking formal, even though it's done online on Zoom. So you want to really make sure that you are smart and your surroundings are clear, that you don't have, I don't know, like a funny looking poster behind you or stuff like that. So you want to really make sure that you're in a fairly neutral professional setting. Close other computer programs because you really don't want to be distracted when you are answering the questions. And so that's that one. You want to practice, but don't practice too much because then you become robotic. So when you're answering questions and you give a very cliche answer, even though it may feel cliche, it might be actually a good answer. But then if you've practiced it too much, it might come across too robotic, and then it'll become disingenuous, and the interviewer won't really like it because you really want to make sure that you come across passionate. Okay, using notes. So you may think that, oh, because it's done online, I can like stick some sticky notes around the computer. That's not what you want to be doing because technically they have these softwares now that can track your eyes. So if the university are strict and they're tracking your eye movement and stuff like that, and you're looking around the room where you shouldn't be and you're not maintaining the eye contact, then you may lose points or you may be disqualified and stuff like that. They track your eyes for exams, so yeah, it is quite scary. And obviously, most importantly, be polite. So obviously, you may have some lag, you may have some disconnecting issues, but these are just things that you will have to bear with COVID. But you just have to make sure you're remaining calm, you're remaining polite. Obviously, if your interview is just lagged out or you're disconnected, explain to them very nicely and be like, "Hi, I'm trying to join back," etc., etc. You just got to remain fairly calm. You don't want to be like panicking because technically that's a test of your how you cope with a stressful environment. Do you panic? Do you like throw a fit, or do you remain calm? Can you diffuse a stressful situation? So these are things that they can tell before you even speak, sort of thing. So just to make sure that these are the things you do tackle straight away. All right, Prasan, could you go to the next slide, please? Right. Okay. So this is a classic interview question that they can use, and they may use variants of this. What was supposed to happen was that me and Tom were supposed to act this out. So I would be the interviewer and the actor, and he would explain to me what was happening. So I'm going to try and give, it'll be quite weird because I'm going to be doing both people. So I will be the interviewer and ask the question, as well as I'll say when I'm the student or when I'm the actor as well. So just bear with me. I'm trying to be two people at once. Um, okay, so you walk up to the interview station. Well, you're not walking anywhere, to be honest. You're on the Zoom, so you'll read the interview station and you'll be let into the room in, let's say, a minute. So you have 1 minute to read the question. So this is what you'll see. So you are reversing out of your driveway and you run over your neighbor's cat. Please talk to your neighbor about this. So first of all, your neighbors. So hopefully you guys are friendly. Oh, is Tom joined to save the day? Tom, can you hear us? No, no, never mind. Right. So first of all, what you notice is that your neighbors. So hopefully you guys can be friendly with each other. But again, that depends on the actor. And by the way, the universities do tend to hire professional actors, so they're very, very good. So if they want to be like, if they're scripted to be very emotional and very, uh, bipolar, then they will be, and it will feel very real. Not too real because it's on Zoom, but in real life, when you did have it in person, it's quite the feeling, to be honest. You do feel like you've actually run over their cat. So how would I answer this? So I will try and give my sort of response to it. Um, yeah, it's not working. That's fine, Tom. So let's say the interviewer goes, so Ibrahim, how's it going? And I would be like, yeah, it's going good. It's going good. Um, drinks were good last night, wasn't it? He goes, yeah, it was really fun. And then the actor could go, how's your pet turtle? And I could be like, oh, my pet turtle's great. I've actually got some bad news to break to you. You could literally be as forward as that. But it kind of depends on the mood and how the actor is, talking. So I'd be like, oh, I've got something serious to talk about. Do you have a minute? So you want to ask the actor, like, oh, could I talk to you? Is this okay? Is this a fine time? And obviously they're scripted to say yes. They're not going to say no and walk off. So they say yes. What's up? And you go, I'm really, really sorry. I'm really, really, really sorry. But last night before we went for drinks, um, I think I was reversing out my driveway, and I know your cat's black, but that's not an excuse whatsoever. But I've accidentally run him over, and I am genuinely sorry. So as soon as you've broken the bad news, expect some sort of reaction. So his reaction could have been like, "What the hell? Are you stupid? Like, what's wrong with you? Like, how could you run over my cat? Are you blind? Are you deaf? Were you on your phone texting? Were you sending a Snapchat? What were you doing? Your FaceTiming your friends? Were you Instagram live? What were you doing?" They could come out with anything, and it'll be fairly recent. Fairly recent, like, topics that they might mention, like, are you high? Are you on drugs? And you go, no, no, no. I was genuinely so sorry. I just did not see your cat whatsoever. It's unexcusable, and I know you've had your cat for such a long time, and I'm genuinely so sorry. And you've got to really apologize, and you've got to really, like, try to comfort them when they are attacking you, like, in a. Is Tom here? Tom? No, he's just teasing us. Um, and they'll keep on attacking you like that. Um, so you've got to really state and hammer home the fact that the cat is irreplaceable. Oh, he's typing away. It's very loud. The cat is irreplaceable, as well as that it must be very difficult for them to handle. So you give them time to breathe and digest the news. Oh, Tom's very loud, isn't he? Let me just give me a second. I've tried. Oh, never mind. So you've got to give the actor some time to digest the news that you've actually run over your cat, and you've got to give them some solutions. So solutions would not be to buy another cat. That's a very classic error that students tend to fall in. You can't replace a cat that's been with somebody for 10 years with another cat from the store. It doesn't work like that. It's something that has sentimental value. And this is something that this is a skill that you need to have in both medicine and dentistry. When very rarely you break bad news in dentistry, but more so in medicine, in hospital placements where patients are suffering with life critical conditions. So you need to be able to, be very professional as well as be very empathetic and talk to that patient in a very caring and nice manner and give them time to grieve if they need to, for whatever the news.
Sorry.
And after you've given the actor some time to breathe and they're happy, they should resolve, or the actor will say time's up, and that's when you stop. So some brief overviews of this. So you want to be completely honest. You want to get to the point, but read the situation. So you don't want to be blunt. You don't want to be really arrogant about like, oh yeah, I ran over your cat. But anyways, we'll move on. That's not how you want to do it. So you want to read the situation carefully, and each actor will have their own points. So they could be acting very blunt. They could be acting very pushover. So it'll be very easy to resolve the situation. They may have some other things where they will never ever budge from their point, saying that I hate you, I'm going to call the police or something like that. You don't know what they could say,
really,
but you always try to let them express their emotions
at the moment,
and try to console them.
Some questions
notice how I said it was my fault.
on
like
the chat.
I said, I'm sorry, I ran over your cat. You don't want to shift the blame onto someone else. So if I said, oh, I got a text message and I got distracted,
and Thomas would be answering questions while Ibrahim would be presenting.
So stuff like that, you need to be careful you don't trap yourself in those situations. If anyone noticed, you notice how the question said you run over your neighbor's cat. I wonder how many people realized, is the cat dead or is the cat alive? Wait, is Ariana talking?
I was talking before, but I'm just going to make this small comment and then you can go ahead.
I can't hear her. Is she talking now? No? So can I carry on talking? Yeah? Carry on? Prasant, can I carry on? Or is
I think you can carry on. I think there's a bit of a I don't think Thomas.
Sorry, I can't. I generally can't hear her. No. I can hear you loud and clear.
Yeah, it's fine. It's fine. I don't think Thomas could. I don't think he still would be pressed.
No,
yeah. I think he's just only typing away in the chat boxes.
Yeah. Okay, that's fine. Okay, cool. Yeah, carry on. That's fine. Thank you. So an important thing to note is that the cat is technically not dead unless you make it dead. So if you said, "Oh, I'm sorry, but he's dead," then he's dead now. You can't go back and be like, "Oh no, actually no, he's twitching, he's alive." It's a bit weird. You've broken the bad news that he's dead, so he's dead. And so that's a bit more difficult than saying, "I've actually ran over your cat, but only his leg or his tail." That'd be a lot more better and a lot less severe. And actually, it put the actor off because students tend to actually think of the worst and be like, "Oh, I've ran over the cat, he's dead." You might run him over with your bicycle or something. I don't know, but you've got to play the situation to you. So you want to really maximize it for yourself. If we go back to the slide ahead, Prasan. So that was just one thing to remember, to read the question carefully. So we said respond with empathy, and then the plan for the future was we can't replace him, and that's that last point there. However, I will do my best to try and console you. Spend some time together. We can grieve about it together. Like, some people are really crazy for their pets, so you just want to hear them out and try and figure out what will benefit them the most. So that's the breaking bad news question. All right. Okay, so here's another style of question. So another acting question. Prasan, if you could go to the next slide. Here you are a first year student. So again, this is universal for medics and dentists, by the way. But these are just generic skills that both professionals should have and should be able to handle these situations. So you are a first year student and your fellow student isn't washing their hands after they examine patients. Please discuss with them. Okay, so you have a minute to read this, and obviously you might have done 3 stations before, so you're probably panicking about those stations. Don't do that. Focus on the station ahead. So again, this would have been an acting station. So Tom would have been the student that's not washing his hands, and I would try to persuade him to be like, come on, bro, you really got to wash your hands, etc. So I'm just going to analyze the question and talk about the different ways of answering it. So you are a first year student. So first of all, you're not very clinically experienced. However, you should know the basics of protecting patients, right? You don't run with scissors in the corridor. Basic principles like that. You need to wash your hands after every single patient and before patients as well. These are very common sense things that you should be doing regardless, and it's for the patient's best interest. Okay, then it says your fellow student. So fellow doesn't mean friendly, but also it doesn't not mean enemy. So you can decide when you're acting how friendly you want to be to the student who's not washing their hands. So I was actually going to be like, oh, Tom, we've been friends since college. We both applied to medical school. It's been a crazy journey. You know, butter him up, try and ease the situation into him, and then you'd be like, right, yeah. So I noticed in clinics, actually, I know it's our only second session, so you can mention it however. So if you said, oh, it's our first session in clinics, you can kind of overlook the mistake, because everyone makes mistakes. People forget. We're in first year, so everyone's trying to think of everything. If it was in fourth or fifth year, it would be a bit more serious. So you could be like, oh, we're friends. But if you said, oh, hi, Tom, he could then be instructed to be like, mate, I don't even know you. I've only known you for 2 weeks. Why are you approaching me like we're friends? So it's quite a harsh situation then, but that could be the actor's instructions. You don't know what they've been told to do. Like I said, the good cop or the bad cop sort of thing. So you could be like, yeah, so I overheard you saying that you don't wash your hands in clinic, or you could be like, I saw you not washing your hands after patients. And then you've got to explain. So the marks here would be identifying the situation and the issue, and then explaining why the benefit of what washing hands are. Everyone's listened to Boris Johnson's, happy birthday 20 seconds thing. So that's pretty much it. So you've got to be like, well, washing hands, it reduces the bacterial load, it prevents cross-infection, cross-contamination, prevents you from getting ill as well as other people. There's something called COVID-19. I don't know if you heard about that recently, but washing your hands prevents the transmission of that too. So you gotta be really careful, and you gotta be quite scientific when you're answering this question as well. You should also be aware of potentially the 7-step hand washing technique or the 5-step washing hand technique, because he could be like, well, I only wash my hands for 10 seconds. Isn't that enough? And the answer is no. You've got to wash your hands for 20 seconds or the 7-step technique, and there's no in between. So you've got to try to know. And if you weren't aware of the 7-step washing hand technique, they won't penalize you for it, but it's good basic knowledge to have. So here you might come at a crossroad where Tom could be like, well, no, I don't see the point in washing my hands, so I don't care and I don't want to do it ever. Get off my back. What do you do in that situation? So the actor's been like, no, I don't care, you shut up, go away. Well, you have to put your foot down and be like, well, Tom, I'm going to have to escalate this. And he'd be like, why are you overreacting? Why are you snitching? Snitches get stitches, whatever they might say. Well, you got to be like, because we treat patients and our entire career is based on patients' well-being. So patients' interest comes first. That's every GMC, so General Medical Council, and GDC, General Dental Council principle. It's the first one. The patient always comes first. So by not washing your hands, you're directly endangering patients. Prasant, can we move on to the next slide? Cheers. So yeah, this is just summarizing what I just said. So friend or foe, so you got to read the question carefully and be like, okay, fellow student, am I going to be really friendly with him or her, or am I going to be like, oh, hostile towards them? Preferably you guys choose the friendly side, because it'd be a lot easier to talk about them. Tom, we can hear Tom, so he can just say what he needs. That's a bit difficult. Appropriate setting. So I actually forgot to talk about this. Tom would have actually corrected me, but you can't talk to the student about not washing their hands in front of the patient. There's something called professional duty of candor. So there's a time and place for everything. So let's say your mum's telling you off in front of your friends. It feels kind of embarrassing. Same kind of principle applies in medicine and dentistry, where you shouldn't be, belittling or complaining about another professional, because when you're in medical and dental school, you're technically known as medical and dental student professionals. You are healthcare professionals in the training, so you need to act like them too. So one of the ways to act like that is to, hey Tom, could we talk outside clinics or could we talk after clinics? Because I want to just mention about the hand washing technique thing. You shouldn't bring this up in front of patients because it's a very it's quite, like I said before, quite embarrassing, firstly, and secondly, it's not the correct way of doing it. Again, the GDC and the GMC principles do talk about this. So this is how these sort of questions, they kind of suss out these sort of qualities in people and see how they react to different situations. Like I said, duty of healthcare professional, so that's that. COVID-19, so that's a big one. So he could be like, yeah, but washing my hands for 2 seconds gets rid of all the COVID germs, and you got to be like, no, that's not how it works at all. Like, you got to be serious about this. So like I said, the hand washing technique, using soap. Imagine if you washed his hands just with water, there's no point. So these things you've got to be aware of, and as well as calming them down. So if when you are being told off, nobody likes being told off. So you want to do it in a way that's not telling off, like a teacher shouting at you for talking to your mate. You got to be quite nice about it. Got to be quite friendly, etc., etc. Someone just says so I can hear you guys. All right, let's try it. Just give me 1 second, guys. Hello? Hello?
If I unmute my mic like that, can you hear me?
I can hear you, yes.
Okay.
Oh, it's got like a double echo. It's quite weird.
Is this going to work, potentially?
I don't know. I'm trying to think which way should we mute ourselves. Wait.
There's a lot of feedback.
Wait, can you hear me now?
If this will.
Can you hear me now? Can you hear me now?
Yeah, I can hear you now. Yeah.
How about if you lower the computer volume? That will reduce the echo.
Yeah, I've got the computer volume on nothing.
Where is it echoing from? Is it still echoing now?
Yeah, I can basically just hear myself loads. I'll mute
really?
myself.
Wait, can you hear me now?
Yeah, yeah, I can, yeah.
And there's no echo?
No, there's no echo.
Okay.
Have we sorted it?
Right. Yeah, that's fine. We can use this. I can hear myself, but I'll ignore myself.
Okay, fingers crossed this will work. Can they hear me then?
Oh wait, I think. Can you guys? Is it okay, or is it bad echoing?
We're hearing yeses. Great news.
We can hear. Good echo. Still, no, it's fine.
Perfect. Bad echo.
Oh no, it's not bad. Okay. Wait, am I playing on speaker, Tom?
Yes, you are. Yeah.
Put your headphones in, you dummy.
Sorted.
One sec. How's that?
No echo now. We're getting a lot of yeses. I can hear you perfectly fine.
No echo. Yeah, I can hear you. Right. Okay. Sweet. Let's crack on.
Okay. Yeah. Sorry about that, guys. Technical problems, which is a great part of being on computers and everything like that.
Right. So, should we crack on?
Yeah.
Okay, sweet. So I did both roleplay scenarios on my own. So weird to try and act them out. Well, I didn't even act them out really. Anyways, I've done the dirty hands one, and I've just finished explaining that. So we're going to move on to the euthanasia one. Is that right?
Yeah.
Sorry, Thomas. A little bit of echo coming from Thomas's mic. You might need to mute it on and off whenever Ibrahim's talking, perhaps, just to stop the echo.
I can't actually see the slides, so let me know when you're ready.
Wait, Tom, did you hear what he said? He said to reduce the echo slightly. Oh wait, you muted yourself. Have you muted yourself?
No, I've not done anything different now.
Okay, so is everyone okay with listening to Tom? You mute your computer. Yes, we get echo when Ibrahim talks. Everyone's fine. Okay, everyone's fine. You can't hear me. Well, if you're replying, you can't. There is no echo when Tom is speaking, but there is one when Ibrahim's speaking. It's only little, you can still hear clearly. Right, okay, we'll just crack on. Right, that's fine. Prasad, can we go to the next slide, please? Oh, Tom's left. Oh, can you? Okay, fine. Fine. Can you see the slides? So we're on the euthanasia slide. Yeah, sweet. So we're on the euthanasia one. So I'm gonna ask you the question, Tom, and if you could answer it, and hopefully they can hear you. You guys can hear Tom, right? You can't hear Tom. He's gone. Yeah, Tom, I think you're gone, mate.
I think he's left the presentation again, I'm afraid.
Yeah, you left the presentation. Oh god. Thank you guys for being patient. This is the hidden interview question. To be very patient for 45 minutes whilst we try to sort out the technical problems. Go for me for Tom. Yeah. Are you joining back, Tom? This is the hardest thing you've done an interview. Yeah, we've got a hashtag, Tom, for you. Bring Tom back. You do euthanasia questions apply to dentistry interviews too? I mean, I've never seen it on any dental interview question websites, as well as personally asked my friends as well. But it's a skill to have. The principles from answering this sort of question. So I don't want to give too many spoilers, but we'll get to it in a second. Just don't worry. Tom, you back in? Let us know when you're live.
Hello, everyone.
Okay, guys, can we hear Tom?
Happy days.
Yeah, Tom, you got your earphones in?
I've got my phone next to my head.
Okay, it's fine. Is that okay for everyone, guys? No echo. Yes, sick. All right, I'm just going to crack on, and we're just going to finish this off. Yeah, no more stopping. This train has left. Okay, so, Tom, what are your views on euthanasia? Do you think it is fair to allow patients to suffer and not be allowed to end their life?
Okay, so euthanasia is obviously a highly complex topic, and it's one that's of debate now, and it will be for many, many years to come. And the current stance in the UK is that it's illegal. So as a practitioner, you must respect this, regardless of your views on euthanasia. So euthanasia means allowing someone to voluntarily die in order to alleviate their suffering. So there's various different types, such as voluntary and involuntary. So as far as whether, answering the question, my views on euthanasia, I think a brilliant place to start is to explore autonomy and respecting patients' autonomy.
Do you know what autonomy means?
So a person is responsible for sort of the decisions in their own life.
Good.
So yeah. So a person's responsible for their decisions in their own life. So when it comes to euthanasia, surely they know better than anyone whether it's what they need to do or like anything like that. So it's down to them.
Would you say that for all cases? Let's say like an Alzheimer's patient who's very severe case. Do you reckon they should have the choice of euthanasia?
So another important consideration, well, you bring that up now, is capacity and competency. So you need to see whether they're able to make the decision themselves, whether they're medically able to, or whether they're at the age to legally be able to do that. Yeah. And then, so exploring the different pillars of medical ethics, beneficence and non-maleficence is also incredibly important to look at. So beneficence is, beneficence, sorry, Ibrahim.
That's fine.
So beneficence is your responsibility as a practitioner to do what's in the best interest of your patient. And so if they're suffering on a daily basis, and they will do for a prolonged period of time after this, it could be argued that preventing the euthanasia and not allowing them to be euthanized will prolong their suffering. And then, yeah, non-maleficence as well means that you shouldn't inflict harm, or should inflict the minimum amount of harm possible in a bad situation. So once again, keeping someone and prolonging their suffering isn't the best.
Good. Right. So that was Tom's answer, guys. Hopefully most of you heard that. What do you guys think? Quickly, we'll give you guys like 10 seconds. Yeah, we'll come on to that, Miriam, in a second. What do you think about his answer? Excellence, 10 out of 10, 5 out of 10. What do you guys think? 1 million out of 10 as well. A good, well-balanced argument. Interesting. 7s, 8s, no standard. Sweet. All right. Could you move on to the next slide, please, Prasant? We're just going to explain this. Well, Tom actually will explain this.
So yeah, so that answer, slightly flustered, that was. But yeah, so ultimately with a question like this, you need to appreciate that it's complex. You then need to take your time to explore both sides. So what I did, whether you picked up on it, was I was sort of in favor of euthanasia the whole time. So my sort of answers, although I kept a structure and moved through the principles of medical ethics, I sort of only gave the in favor argument each time. So it's important to keep a balanced argument with this. And then you also need to say the current stance of whether it's illegal or not. So obviously in the UK, euthanasia is currently illegal, whereas in other countries it might not be. And when necessary, you need to bring up the importance of competency and capacity as well. But yeah, keeping to a structure is one of the most important things with these ethical questions. And a great way to do that is to, in your head, go through the principles of medical ethics. So autonomy, beneficence, non-maleficence, and justice. And if you haven't come across these before, no worries. Just have a search now and make a note of this, because this is a great way to approach these questions.
Yeah, so this is a standard ethical question. And so, like the person before said, it's relevant to dentistry. Ethical questions always try to target candidate-student balance for and against, or try to be as balanced as possible, and take a holistic approach on that. The word holistic just means to see it from all views and all angles. So to make sure that you're not seeing it just from, oh, but the patient's suffering, etc., but then not focusing on, well, life is sacred and who has the right to take life. So if Tom said that a bit more clearer, then it would have been a bit more easier to understand his question and probably push him to a 10 out of 10. Obviously, it's not a bad answer whatsoever, but if you guys could practice these sort of, balance for and against it's easier for you to come across, more competent and more structured.
Yeah, and
if you notice as well, sorry, Tom actually paused for a bit. He got stuck on beneficence, but that actually wasn't a bad thing. So if some of you thought like, oh no, Tom's choked, sucks to be him, technically it's fine because he took his time, he repeated his last sentence, and he carried on. And that's very important because in an interview, it's very stressful. Online as well, it's probably a bit more stressful because it's always lagging and stuff like that. But it's always important to plod on and just be like, okay, I've got 3 more minutes or 4 more minutes left or whatever, and just get through this, and you'll never have to think about the statement again. So if the way Tom just kept on going and finished off his answer very nicely, that's very commendable. So on the notes that they could write on the mark scheme, they could be like, student got stuck, however, continued to persevere and gave a decently structured answer. I just want to say that, Tom. Sorry.
Yeah, thank you. So another thing as well with questions like this is they're not looking for your answer of are you in favour or are you not. They're looking for the structure and the way you approach answering the question. So just keeping to a structure that's easy to follow. And then when finally concluding, you don't have to conclude that you are in favour. You can say that you're sort of on the fence and would prefer to do further research and reading surrounding this topic because it's a highly complex one. So don't feel pressured to pick something.
That's probably the best answer, is to be like, it's probably, you guys had it with your teachers in college where they've said, oh, it's a good question, I'll come back to you with that. It's like kind of doing that but more professionally and being like, yes, I've stated the fors and against, however, I'm still fairly on the fence about this since it's a very controversial issue, and this is still being debated by medical professionals worldwide. So, and the reason why not all countries have adopted euthanasia is because it's so controversial and it's a very difficult and complex issue to tackle. So I'm fairly on the fence, and that's a perfectly fine answer. You don't lose marks for saying for or against. You would lose marks if you don't give a balanced for and against answer rather than your own opinion. That's the most important thing here. Right, should we crack on? Hassan, could you go to the next slide, please? So this will be the last question for today that we're going to run through, and this is the one that every single interview, and if you don't get it, then you're probably at the wrong interview, most likely, because they ask this no matter what, in some sort of form. So they might ask you, what characteristics of a doctor do you possess, or why do you want to study medicine, or what's your evidence of motivation to study medicine or dentistry, etc., etc. So they can word it in different ways, but essentially it means the same thing. Should I answer this one first, Tom? And then do you want to answer it next?
Yeah, sure. Yeah. Okay. So, Ibrahim, so why would you like to study dentistry? What attributes do you possess that make you suited for such a career?
Okay, it's easy to answer that now because I'm in fourth year. Right. Anyways, so the main reason why I wanted to study dentistry was because of the patient interaction as well as the academic nature of the profession. So with dentistry, having read about it briefly, it's a very complex and detailed specialty of medicine, which really catches my eye, as well as the fact that I can use my communication abilities that I've developed over my time at NCS, or insert here your personal statement of communication, as well as insert here your teamwork. So you can insert your evidences here, and then you could be and go on to say, so with this and showing my passion for communication and having worked at a hospice as well, I think I could best utilize these fundamental building blocks in dentistry and further develop my skills there. Dentistry as well for me has always been a very interesting career, as at my work experience I've seen a dentist handle many difficult situations, and every patient is different. It's not just the tooth, it's actually the patient and then their surroundings and their social history, and it's a lot more complex than it meets the eye. It's almost like trying to figure out a puzzle piece and trying to plan the correct treatment plan for them and making sure you're doing everything best for the patient. And I find that very rewarding because the dentist sees the patient from day one, diagnoses, produces a treatment plan, and sees them afterwards for care. And this is actually why I chose this rather than medicine, is because I feel like dentistry is a bit more interpersonal, and you get to see that you get to see the patient through and through. Whereas in medicine, it's quite referred on, and it's a more blocked patient interaction.
Awesome. You're making me want to do dentistry, actually. So yeah, that was quite a quality answer. That was really good. One thing that I immediately noticed from that is it sort of rolls off your tongue. You're passionate about it. You haven't over practiced it, and sort of like you're not remembering or recalling something that you've learned. You're literally just you've sort of like learned a rough structure, and you're then just kind of letting the words sort of come out. And I think that's the best way of doing it, because that's how to show your enthusiasm and everything like that. So I think that's really good. Well done.
Thank you, Tom. Really appreciate it. I'm going to tell my mum now. But yeah, no, Tom's point is very important, is to always sound passionate. Well, try to sound passionate, and that passion comes from a natural, raw answer. Over practicing this question leads you to sounding like a robot. So you really want to be careful. I actually had another answer planned, where I talked about why not medicine. I think you're going to do that. Anyway, so everyone's probably waiting for Tom's answer, since mostly medics are here. So, Tom, why would you like to study medicine? And actually, I didn't answer the question fully. Oh, I did technically, yeah. And what attributes do you possess that make you suited to such a career?
So there are literally so many reasons why medicine appeals to me. Particularly the opportunities to lead teams or just work as part of a multidisciplinary team. Also the problem solving on a daily basis. But for me, it's sort of the diverse opportunity to communicate on a daily basis, whether or not that's with the families, friends, or the team around you. So what's initially quite funny is I was motivated by science and sciencey subjects at school, but I initially wanted to explore veterinary medicine, and I was fortunate enough to get some work experience at a veterinary centre. And although I could obviously interact with the owners, I noticed that the lack of patient interaction, that was less of the focus, and this is something that was very different with medicine. And this made me sort of change my direction from veterinary medicine towards medicine, because communication is something that I absolutely love to do, and it's something that medicine offers in the most diverse way. Like I said, with patients, families, and throughout the various members of the multidisciplinary team. So I've tried to sort of, with my work experience and experiences, tried to hone in on some of the complexities of communication that I would experience in a career in medicine. So I had the pleasure of volunteering in a place called Revitalise, which was a holiday respite centre for guests with MS and brain damage. And this gave me an appreciation of many of the communication challenges that I could come across throughout my medical career, and sort of like how you have to then adapt to get past them. So many of the guests were completely non-verbal. So this was obviously immediately like challenging. How do you communicate with them properly and like everything like that? But you start to pick up their mannerisms, their personality, and read their body language, and read their non-verbal cues, like their facial expressions and things like that. And then you can sort of, I don't know, I just found that incredibly rewarding, working out what these guests wanted to order, and sort of giving them that. And then beyond that, I also did work experience in a hospice as well, which showed me a different side of communication, the sort of professional communication and the honesty and care that you need to take with it. Because obviously in a hospice, you're dealing with terminally ill patients, and they really appreciate how you talk to them. If they ask you a question of for advice or how long they've got left, they appreciate the honest answer. And this was such a brilliant experience for me, and it helped me realize sort of the harsh realities of a medical career, and how even though the hours of the job that you do, it's more than that. You go home as well, and what you've seen during the day, you think about it for the rest of the day. So it made me appreciate the sort of stresses of the potential career, and also the amount, as in the support that you sort of need around you. And yeah.
Good answer.
Yeah.
Couldn't stop you. You're on a flow. It was very interesting. Thank you, Tom. What do you guys think? Again, what would you rate Tom's answer, guys? 10 out of 10? 10 out of 10. What are we thinking? Yeah. Tom, actually a good question above. So you said veterinary, which is good. I think so. Jessica, who says, how would you answer why you want to be a doctor rather than a nurse? So specifically that one, and that's a very common one. So what would your personal answer be? And then I'll try and give as well, to be honest. Like how goes, how do you describe the differences, or what is the difference between a doctor and a nurse?
So I would say it's really important to appreciate both nurses, doctors, and everybody that's part of the multidisciplinary team. Mm-hmm. And with your answer, it's really important to sort of not say you want to be a doctor because you don't value nurses or something like that. You need to find something that differentiates doctor from nursing.
Yeah.
So you could say you could go down the route of prescribing.
Yeah.
And things like that. But yeah, I'll have a quick think about that and then come back with an answer in a second.
So I was going to say, because for dentistry specifically, the dental nurse does do a lot for the dentist. And so if you've not had any work experience, a person who isn't really passionate for dentistry wouldn't be able to tell the difference, or wouldn't be able to give a good enough answer. My personal answer would be, and obviously everyone's personal answer is different, and for their own different reasons, but you have to obviously be respectful, like Tom said, for the other profession. So my main reason would be that a doctor / and as you're a dentist, you're still technically a doctor, is the leadership and ownership of the patient. It mainly falls down onto you. Though the nurse is a legal witness as well, and she does, help out with treatment, you are the person that makes a decision call. It's never the nurse that will prescribe the drug or give a treatment plan. The nurse is there to assist your work. So you've got to give them some evidence to be like, so I've shown team leadership from, NCS or from a global entrepreneurship competition, or in playing football team, being football captain in my school team, or something like that. And I've enjoyed having the responsibility and fulfilling my teammates' goal, like scoring goals, or something not cliche like that. So you've got to show that leadership would be a main thing, making decisions, and how you've shown that. So you've got to always have some evidence to show how you started or how you wish to develop those sorts of skills. That's what I would come across it. Tom, what would you say for you?
Yeah, so when you're giving those examples like that, always link it back to why that makes a good dentist as well.
Yeah.
So you talked about the leadership, so it's great. So why does that make you a good dentist? That's important to consider as well.
Exactly. So yeah, that's that. We'll take questions in a second. Prasan, could you move on to the next slide, please? And so yeah, this is just a brief overview. It's really asking why you're passionate. So no right or wrong. Try and be honest, and try and you've got to self-reflect on this, and you've got to really think about why you want to study medicine. Don't go Googling it. You can Google for some ideas, but at the end of the day, it's why are you picking this career? You want to make sure, like we said, you don't over-practice, because then you lose that passion. If you really do want to get into medicine or dentistry, it will shine through in your interview. And if you don't want to be there, then that will also shine through. A couple of my mates, they came in very, they told me they came in like lustered. They didn't try at all to practice anything. And obviously they got 4 rejections. It's a bit silly, but people do it and they expect to get in. So obviously you got to show some commitment. You got to, have a rough idea of, okay, if I'm going to talk about leadership, I want to talk about these 2 points. If I want to talk about teamwork, I want to talk about these 2 points. And don't try and overthink it. Be like, oh, but it might be such a crap point. Like, I don't think anyone will take it seriously. If that's the only thing that you've done that's showing team leadership, then you're going to have to talk about it. If you have other experiences, then you can mention them as well. But that's why they say you've got to really diversify your personal statement. Go out there. Tom helped in a hospice as well as what was it called? Revitalize.
Yeah, Revitalize. Yeah. It's a holiday respite centre.
Yeah, for guest with multiple sclerosis. So that's very interesting. And it's a very unique situation to him. And he could speak about that for days in, because you could tell from his passion. And that's why you guys rated him 10 out of 10. So it's a very good thing to look for. I've got another session coming up. So if that'll be the end of the slideshow, we could take some questions for like 5-10 minutes. Then I'm going to have to jump. I don't know if Tom can stay for a bit longer if possible. Is that okay, Tom?
Yeah, can I see the questions? Yeah, I can. Could I quickly just add as well? So with a lot of these interview stations, I know Exeter was particularly like this, but they take notes on how you performed in the question that they've asked you. But then what they do is have a tick box, and it fundamentally comes down to, do you want this person to be your doctor?
Yeah, that's the last question.
In the case of a dentistry interview, do you want this person to be your dentist? So it comes down to a yes or no in the end. So as obvious as it sounds, like, just make sure you maintain strong eye contact throughout, a smile on your face, and just seem positive, and just use your hand gestures. And this will really help to kind of swing the balance on that question, and hopefully you'll get a tick. You'll get the yes.
Yeah. So I'm just going to go from the latest question up. So, Prasant, could you go back to the euthanasia slide, please? I think a student wants to write down a few things. It's the one with the picture in the background. Yeah, that one. Yeah, that's the one. Just put that up. There you go. Okay, that's one done. Okay, let me scroll up a bit after the ratings. Why did I choose Manchester University? My options were King's College, Manchester, Liverpool, and Sheffield. I got 4 interviews and I got 3 offers. I failed my Liverpool one on purpose just because I had already had my 3 offers, so I didn't want to go there. So that was that. And I went to Manchester over King's due to personal reasons and to save money, not going to lie. But I do enjoy Manchester a lot. It's a very, very, very quite chillaxed university, but it's a good course and it's very good for dentistry. Okay, Tom, for you, what is the most difficult question you've experienced?
So the most difficult... So I would say it's more the context of the situation. So it was during my Exeter interview. So it was the NHS hot topic question. So I went in, smile on my face, put my hand up to shake the interviewer's hand, and I was like, "Nice to meet you. I'm Thomas Lambert." And he literally looked me in the eyes, looked at my hand, looked at the seat, and just told me to sit. And I was like a bit blown back by that. But luckily I'd been watching Apprentice, and they'd just done the interview stage on that. So I sort of had it in the back of my mind that things like this could pop up in an interview. So that was such a hard situation. And I just sort of made sure that I tried to compose myself as much as possible, maintained eye contact. And when it got to the end of the interview, I kind of stood up and I put my hand out again and I said, "Thank you very much for that interview. I really enjoyed that." And then he shook my hand at the end.
Got him. Got him at the end.
Yeah. So I feel like, just be prepared for things like that. They don't always happen, but obviously a patient in real life could put you in all sorts of situations. Yeah. So some interviews might want to reflect a similar situation. So they might have a moody interviewer.
Tom also sleeps on a bed of nails, guys, so that's why his nerves are bit of steel. He doesn't fear anything. Okay, so moving on. How many examples should we have for each personal skill, such as communication? There's no set number. I say safety, go for 3. Just have 3 on the top of your head. But it should be detailed. It shouldn't be like, hi, I put my hand up in class, and hi, I like talking to my friends. Anyone can do that. It should be a bit more, rich in experience. I went out to seek my own work experience. I contacted many dental practices. This was very difficult. However, I persevered and I managed to secure, 3 weeks, 3 months. I actually got 6 months worth of work experience, which was very lucky. But I, sweet talked my way into that. So I actually boasted about that, and they really liked that. So you should have a fair few amounts.
Yeah, make sure you go for quality over quantity.
Yeah.
Because obviously there's no point having 5 mediocre examples when you can have 2 amazing examples.
Exactly.
Like, you'll get a lot further with those.
What are the qualities they're looking for other than leadership? What do you mean? They're looking for a lot of things. Leadership, teamwork, communication, empathy, sympathy, academia. So,
problem solving.
Yeah, problem solving. What else?
Commitment,
commitment,
tenacity.
Motivation. Yeah, tenacity, exactly. Perseverance, not giving up. Tom showed that indirectly.
Organisation.
Pausing and then carrying on. So yeah, did they test your mind dexterity and your MMIs? No, but I have heard some universities do. How would you explain why I've done this? Could you explain Vitalize? No, that's his secret answer. No, I'm joking. Go on, Tom. Do you want to talk about your Revitalize a bit? Just briefly, so we can carry on with everyone else's questions.
So Revitalize was a holiday respite centre for disabled guests with multiple sclerosis and brain damage and things like that. So in other words, people that it was a holiday respite centre for the families that would otherwise be caring for their loved ones. So they would go there for a 2-week holiday to give their family a rest and stuff like that. And it was such a great experience because, I walked into it and I'm like a good guy, everything like that. And I sort of walked in and then I walked in and I noticed obviously a lot of people in their wheelchairs and everything like that. And which, I don't want to sound bad, but after the week, it really taught me that everyone is literally the same. And I built such good friendships with everyone. And it was like, I'd really recommend an experience like that if you have the opportunity, because I felt like I benefited so much from it.
Perfect, making me want to go there now. Right, so let's see. Euthanasia slide, done that. Did any of you guys have an MMI at Cardiff University? Tom, did you?
No, I had Exeter.
Yeah. I didn't. No, wait, what did Tom just say? Yes or no? Blah, 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 blah. Oh, damn, that's awkward. Most difficult interview. Ibrahim, what type of interpersonal skill task did you have to do at Sheffield interview? I'm not sure. It was probably the role play. They had a role play, and they had an angry patient waiting in the waiting room, and they were late, so they were shouting at me, and I had to resolve the issue. So that was that. How did we meet? We met on Tinder. No, I'm joking.
It was love at first sight, wasn't it?
we met via Getting Into Med. It's this company that we're both aware of. Is work experience and volunteering more desirable than shadowing? Shadowing is technically work experience, so you're saying is work experience more valuable than volunteering? The answer is no and yes. Both are very equally rewarding. Both individually different. They're both amazing things to have. You should definitely have both.
Yeah, I would say whatever you do, whether it's work experience, volunteering, shadowing, keep a diary log of exactly what you got up to and exactly what you learned, because that's the most important thing. So when you're preparing for interviews, like knowing those details, that's what separates you from the other people. So it doesn't matter whether you've done 6 months of experience. If you can't remember those fine details and things like that, then that's the most important thing.
You're on Instagram as well. Okay. Does anyone know any online work experience? Yeah, it's very difficult to get work experience nowadays. I'm sure university will take that into consideration, especially for year 12s and year 13s that are applying. How would you show your portfolio on an online interview? They never ask for your portfolio. Well, Tom, did you get asked for your portfolio when applying to medicine?
No, I didn't. But I know when we graduate, I think portfolios looked at when we were going into hospitals.
Later in life, you will, not for applying into medical or dental school. Did they have role play at Manchester? No, not at my time, but they do now because they have MMI. How did you practice your role play skills? I'm very good at acting and I'm very talkative, so I'm just decent at it. I would practice with a mate, so you could practice with Tom. No, Prasant, I can't hear you. Wait.
No.
Hello?
Can you hear me now?
Yeah, I can hear you now. Sorry, what were you saying?
That's fine. Just saying that we've been going all the time for about 20 minutes now. But I appreciate we're a bit late with the starting up.
Yeah,
as well.
sorry about that.
No, it's fine. It's all right. I mean, we've got another.
I'm just wrapping up now.
Yeah,
really
that's completely fine. Yeah, that's not a problem. Yeah.
Okay, where's the session gone? No portfolio. Did they have role play? No. How'd you practice? Yeah, practice with a friend. Tom, why Exeter?
So for me, I was actually doing medical sciences at Exeter beforehand, so it was quite a logical step. I knew that I liked the place I knew that I liked the lecturers and things like that, but particularly I really liked the problem-based learning approach that Exeter does. So working in small groups and getting a sort of case study and creating your own smart questions and exploring that the best you can. I just really like that approach of learning.
Cool. This is frozen. Why has that happened? Is that everything? Oh, last few questions. Have you ever performed a root canal surgery? Which I did one, really complex. No, not yet, and I'm not allowed to see any patients yet because of COVID. So hopefully COVID clears up. If you weren't able to get any work experience because of COVID, what would be the next best thing? Not gonna lie, you can't really replace what you see with your eyes next to a dental practitioner or a GP or wherever. You could read some blogs and you could read some books to show your interest, but don't be too worried about this because the medical schools will be thinking about this when you guys apply. So that shouldn't be your issue. So you self-isolating, staying at home, being safe is more important than you running out to hospital trying to sneak in and see a surgery. Your well-being is more important.
Yeah, you can also do reading as well. So you said about blogs, but also various books as well. Like A Curious Incident of the Dog in the Night Time's a great one if you want to learn what it's like to live with autism. And that's a good book. Yeah. Virtual work experience. Yeah, if you can. It's very hard to get by though. Yeah, that's it. Sorry about that, guys. For the roleplay, kind of botched it a tiny bit, but we came through in the end. Oh, Tom, could you type in the book, please? Yes, I'm sorry, I'm just typing it. A Curious Incident of the Dog in the Night Time. Dog. So it's quite a short book. It's 150 or so pages long, but it's written from the perspective of a child with autism, and I brought it up in my interviews. It's pretty good.
Is it autism or Asperger's? I can't remember.
I think it's autism.
Is it? I think there's another book.
Yeah.
Yeah, never mind. Anyways, thank you guys. We've ran over a lot. And any questions, do follow us on Instagram. We'll try and get to you. We're going to run a session soon again. It got cancelled because of COVID, but we'll be doing it online practice. And so, have a read on the Instagram page and we'll post some further dates later on. Take care, guys.
Awesome. Cheers, guys.
Bye. Thank you very much, guys. Thank you very much. Right. So
I think I'm actually on next right now as well. I've got another.
You've got another.
Yeah. Cheers, man.
Alrighty.
Take care.
Alrighty. Take care.
So I'm on for I think 340, becoming a dentist, aspiring hub 3.
Okay. I think that might be on a different one because from my time, let me just have a quick look.
Do you know where it is?
That's what I'm trying to find for you.
I got the email that said Aspiring Hub 3.
Right, I'll have to track it down.
Oh, let me just.
I think it could be Aspiring Student 1.
Do you know if there's a timetable I can access or something?
Let's have a look. We've just got individual ones. I think if you go to it might be on the reception page. Might get a timetable on there.
All right.
Yeah.
Yeah, I'll leave now. Thank you.
All right.
Take care.
Okay, no problem.